So today I'll be talking about the mRNA melanoma vaccine. I'm just going to give an update about that. I get a lot of questions from people who underwent surgery for high-risk melanoma and they want to receive that vaccine. Well, that vaccine is part of a clinical trial. Both Merck and Moderna, they launched a phase 3 clinical trial of the combination of the mRNA vaccine, a melanoma vaccine, or it's called mRNA 4157, and also known as the v940 vaccine, in combination with pembrolizumab or Keytruda for people with high-risk melanoma. And the phase 3 clinical trial, basically they are randomizing people with either stage 2B up till stage 4 melanoma. They should have complete resection of their disease, and they are randomized in a 2-to-1 fashion to receive either the combination of the mRNA melanoma vaccine plus pembrolizumab, or also known as Keytruda, and the other arm they are receiving Keytruda alone. The vaccine is given every 3 weeks for a total of 9 cycles. And the Keytruda is given every 400 milligram every 6 weeks to complete a total of 9 cycles or 1 year of treatment. The other arm that is receiving Keytruda alone, they are giving Keytruda 400 milligram IV infusion every 6 weeks to complete 9 cycles or 1 year of treatment. And this clinical trial is launched in several states. Certainly you can go to clinicaltrials.gov and search for this clinical trial and see if there is any facility or cancer center in your state where this clinical trial is open. And if you're interested in it, certainly it's something important to advance the science, and hopefully in the future we will have an mRNA melanoma vaccine added to immunotherapy to decrease the risk of recurrence for people with a high risk stage 3, 4, and even stage 2 completely resected melanoma. This is not the standard of care. This is not available. I cannot order it as an oncologist. It has to go through a clinical trial. The v940 or the mRNA 4157 is a single synthetic mRNA coding for up to 34 patient-specific melanoma neoantigens. So it's a personalized vaccine. This is a personalized vaccine. It's designed based on the characteristic and mutational load or mutational signature of the patient's melanoma. It's not just a standard vaccine given across the board to everybody. It's really a personalized vaccine. Of course, the Moderna and Merck company, they initiated this phase 3 clinical trial based on exciting results from a stage 2B clinical trial. The stage 2B clinical trial, also known as the Keynote 942. In the Keynote 942, people with stage 3B, 3C, 3D, or 4 completely resected melanoma were randomized also in a 2-to-1 fashion to receive either the mRNA melanoma vaccine, and in this trial they gave also one dose every 3 weeks for a total of 9 cycles or 9 doses of the vaccine, combined with or in addition to Keytruda that was given 200 milligram IV infusion every 3 weeks to complete a total of 18 cycles of 1 year. And the other arm, people just received the pembrolizumab, the standard of care, the adjuvant Keytruda, for a total of 1 year. And the results of this trial revealed that the recurrence-free survival for people who got the vaccine in addition to pembrolizumab was 78.6% compared to 62% amongst the people who got Keytruda. That corresponds to net benefit or relative reduction, or 44% relative reduction in the risk of recurrence and death. amongst people who received both the mRNA vaccine and the Keytruda compared to people who received the Keytruda alone. This is very exciting results. Trial. That's the reason why Merck Company and Moderna initiated the phase 3 clinical trial to hopefully confirm the results. And based on the results of this phase 3 clinical trial, if it's a positive, then hopefully we will have one day the mRNA melanoma vaccine available to people in clinical practice. That is really, really exciting. You know, we have gone through 2 years of pandemic. We have learned a lot of it, a lot from that time. It was a very stressful time, but we learned a lot, and we had this wonderful mRNA vaccines that